Thank you everyone for joining us tonight. My name is Gail Kurtzman, and on behalf of Beth Sikfa Synagogue, I would like to welcome everyone to our program. Just a reminder that this program is being recorded, and if you have questions, please put them in the chat and we will do our best to answer them if time permits. We have received numerous questions in advance and have grouped them into themes rather than by addressing each question individually. We last connected regarding this topic in the middle of March, right as we entered the third wave. I know I can speak for all of us when I say how helpful, insightful our last program was. Once again, our moderator for this evening is Dr. Elisa Naiman. Dr. Naiman is a family physician and the owner and medical director of the Medical Station in North York. She has a master's in health science with a specialization in community health and epidemiology from the University of Toronto, and was a strategic training fellow in interdisciplinary primary healthcare research from the Canadian Institute of Health Research. And Dr. Allan Grill is a family doctor and associate professor in the Department of Family and Community Medicine at the University of Toronto. He is also the chief of family medicine at Markville Stouffville Hospital and lead physician on the Markham Family Health Team, which has been instrumental in York Region's vaccination effort. I would like to thank Dr. Naiman and Dr. Grill for their time tonight, and now I'll hand it over to Dr. Naiman.
Thank you, Gail. So once again, thank you everybody for attending tonight. Amazing that we've come a couple of months and yet we're still in the pandemic. Everybody's hair is longer, and we have moved forward and we're getting closer to the end of this. But things have changed since we last talked, and that's why we decided to hold this update tonight. So let's get started. And what we're going to do right now is we're going to talk second shots. How are we getting second shots? The Ontario strategy is probably the most confusing strategy of anywhere in the country. And we're going to first talk about the cohort of members who received their first shot through Dr. Grill, through York Region. So he's going to talk to us about how these people can get their second shot.
Okay, can everybody hear me?
Yes.
Okay, thank goodness. Okay, hi everybody, thanks so much. We had a little bit of technical difficulties, but if you can hear me and I can hear you, then we're all good. Okay, so I'm just looking up one thing here that I'm trying to find. Okay, it'll come to me. So second shots. Okay, so if we'll start simple and then we'll build up. So if you're 80, if you're 80 years old and you got your first shot, you already have a date for your second shot. But as you know, those dates have been moved up. Alyssa, just give me a thumbs up if you can still hear me.
Yes.
Okay, great. So those dates have been moved up. So basically, you can get an earlier vaccination. So if you live in Toronto or you live in York Region, I'm assuming that's where the majority of people live, all you have to do is go on. So if you live in Toronto and you got your first shot at one of the hospital clinics, like maybe it was Humber, maybe it was Sunnybrook, whatever. Some of those places have already reached out to people and booked their second shot. So to give an example, my parents got their first shot in early March at Humber. So did my in-laws. And I was ready on the Monday morning earlier this week to go online and try to help them get an earlier second shot. But it turns out they got an email late last week from Humber giving them a new appointment for Monday. And they went on Monday, my in-laws went on Monday, they got their shot. So some of you should have already checked your email, checked your junk mail. You should have already received notice if it was a hospital-based clinic to get your second dose. Same thing for York Region. So if you got it at South Lake or Mackenzie Health, even my site, which is Markham Stouffville, where a lot of you ended up going early on, you should have received some notice that you were either going to be given a new appointment or instructions to rebook. So if you were already given a new appointment and you went to get your second shot, thank you for doing that. If you didn't hear from the place you got your first shot, then you are basically allowed, if you live in Toronto, you're allowed to book at any clinic you want. So the easiest thing to do is if you went onto Google, for instance, and you looked up, let's say, Sunnybrook vaccination, COVID-19 vaccination clinic. What it's going to do is it's going to take you to the Sunnybrook website. You can read all about the fact that if you're 80 years old or older, you can actually book a second dose. And as you go down their screen, it's eventually going to, when you click the right button, it's actually going to take you to a general website that doesn't just include Sunnybrook. It probably includes Sunnybrook. It probably includes St. Mike's. It includes UHN. And honestly, you can pick any clinic you want as long as they have a date. And my understanding is that a ton of these clinics have room. So if you're in Toronto, you can go to any one of those sites. And if you want to do it individually, you can. So if you live near, University Health Network and you want to see if there's availability there, just go into Google and put in University Health Network or UHN COVID-19 vaccination clinic. I promise you, the website will come up. It'll talk about 80 plus. You'll click on a button. It'll take you to where you can book. And hopefully there are open spots. So that's the first thing. In York Region, I can just tell you it's even a little bit easier. If you go back to the COVID-19 website, which is, I think, york.ca/COVID-19 vaccine. And even if you put in york.ca COVID vaccine, it's going to come up. When it takes you to the website and you scroll down, it actually has 5 or 6 things you can click on. And one of them actually says 70 plus. And the reason why it says that is that York Region is already ahead of most of the province of Ontario. We opened up to 70 plus at least a week and a half earlier than we even thought we would. So if you click on the link that says 70 plus, which would include 80 plus, it will actually give you a list of 5 or 6 clinics that you can book your second shot. The only thing about the York Region that's a little bit tricky is you have to know what your first shot was. And Alyssa and I will get into the AstraZeneca thing. But for those of you that got Moderna or Pfizer as your first dose, when you go to the York Region website and you're seeing the 5 or 6 clinics available, those clinics will tell you what they're giving out. So some of them will say, we're giving Pfizer. Some will say Pfizer or Moderna. Some will say Moderna. So you want to pick the clinic that is offering the same vaccine that you got the first time. So if you got Pfizer the first time, you want to go to a clinic that's giving Pfizer. If you got Moderna the first time, you want to go to a clinic that got Moderna. And I can tell you, I know 100% guaranteed, York Region has tons of spots available. However, you have to live or work in York Region. So the final thing I'll say before I hand it back to Alyssa is this. Some of you who live in Toronto came to my clinic to get the shot back in March. So what happens to you guys? Okay, so you should have heard from my clinic. That's number one. So that makes it easy. And they should have sent you some sort of notification where you can actually go to their own booking system and book a spot for yourself. That should have happened to you. But right now, if you're living in Toronto, even if you're over 70, you can't book at any of those other places in York Region because it's only for York Region. We got you in early because at the time, we wanted to get everybody in early. So if you're one of those people that got immunized somewhere in York Region, probably just my clinic, and you haven't heard from my clinic, you'll probably hear soon. But if you're anxious and you want to get it somewhere earlier, just pick one of those Toronto clinics. There are numerous spots available. And even if you search City of Toronto COVID-19 vaccination clinic, you can get all the list. And the other thing I want to mention, Alyssa, because we gave this out before, and if not, the show can email it. I can try to look it up while we're talking. There's a 1-800 provincial number. It's 1-833. I'll try to look it up before the end of the night to give it to everybody. If you're totally confused on what to do, and you're over 80 or even over 70 at this point, If you call that number and you literally wait 10 minutes, you will get a live person and they will explain exactly what you need to do if anything I've just explained is confusing. So the default is that 1-800 number, and I'm going to try to look that up simultaneously and put it in the chat. So Alyssa, I'll hand that back to you in case there's anything I missed that you want to fill in.
All I would add is if you have access to social media or family things, please go to Vaccine Hunters Canada. They're always updating. I think what happened last time with the availability of the first shots, when people weren't showing up in the middle of the day, same thing is going to happen for the second shots. We have a big push now that we need to vaccinate as many people as quick as possible with second shots. We're going to come to the reason why this is important, but that's also a really good resource. Like all of a sudden today, Seneca College was through North York General was vaccinating 70 plus with an appointment. So social media, unfortunately, is a good way to access up to date information. Now, what we're going to do is we're going to transition to probably what is one of the biggest questions in terms of AstraZeneca. What do you do if you've had your first shot as AstraZeneca? Should you get the second shot as AstraZeneca? And what are your options? So we were going to talk about that common question. I know a patient asked me that this morning.
Okay, so I want everyone to know that the information you're getting tonight is as up to date as we have. And I'll tell you how I know that. Because this morning I spoke to the president of the Ontario Pharmacists Association. So he gave me the lowdown on where you can get AstraZeneca. Secondly, the province actually released an update that I heard on the news this morning, which is crazy. Like I'm hearing stuff from press release and not from like some of the other tables I'm at, which is fine. And I had a personal conversation with Isaac Bogosh tonight. You should all know who that nice Jewish boy is. He's on CTV and CBC all the time. And I had a personal one-on-one phone call with him to clarify all of this stuff tonight. So this is as up to date as you're going to get. Okay. So first, let me tell you where you can get and how you can get those vaccines. And then I'm going to quickly give you the pros and cons for those of you who got the AstraZeneca first, how you make the decision for the second shot. Okay. So starting tomorrow, pharmacies across the province, and that includes Toronto, are going to be getting a very large shipment, or they're supposed to be getting a very large shipment of AstraZeneca vaccine. This is not expired vaccine. This is new vaccine. The expiry date is like 3 months down the road. And they are going to start advertising like crazy for anybody that wants AstraZeneca as their second dose. You will likely hear about this on the news. You will probably see it on social media. If you call your local pharmacy, they will probably tell you what the situation is. So I just want you to know that AstraZeneca for sure is going to be available in pharmacies starting tomorrow, and it'll probably roll out a little bit more next week. We aren't sure yet if primary care is getting AstraZeneca. I tried to find that out tonight from David Kaplan, who's another member of our shul. Haven't heard back, but the last I heard is it was unclear because some of you might have received AstraZeneca, the first dose, from a family doctor, even if it wasn't your own family doctor, and you're wondering, can you go back there? So even if we don't have the answer to that tonight, I can guarantee you that if you're looking for AstraZeneca as a second shot, it will be available in many pharmacies as of maybe even tomorrow, as of next week, and they will take you even if you didn't get it the first time around with them. That's number one. Number two, there's another choice for those of you who had AstraZeneca as your first shot. So you can also get an mRNA vaccine. When I say that, I'm referring to either Moderna or Pfizer. In other words, you got your AstraZeneca as your first dose, and you decide you want Pfizer or Moderna as your second dose. And I will give you some advice on that in a moment. That is going to be available to anybody in that category through a bunch of clinics in the province as of next week. So what's going to happen next week is that clinics that give Pfizer or Moderna, which by the way, includes my clinic, people will be able to start, again, based on age criteria, of course, people will be able to start booking their second shot as its own thing. So what will happen is all the systems are going to be updating, And you're going to be able to go on to any one of these clinics and say, I want to get a Pfizer vaccine. You'll go on, you'll book. And then when you get there and they start asking you questions like, what was your first vaccine? And you say AstraZeneca, the provincial database system will be able to actually digest that information so it runs smoothly. Up until now, you couldn't mix and match vaccines. The system wasn't set up that way. I have been told by the province that as of next week, this will happen. And somebody just wrote something in the chat, so I will read that in a second. But this will happen, and it will be a seamless process. And I can guarantee you there will be a lot of media information about this, so you'll hear about it. Now let's talk about how do you make the decision between getting a second AstraZeneca shot versus an mRNA shot as your second shot. So this is exactly what I tell my patients. I'm going to tell you the exact same thing. So there are pros and cons of both decisions, okay? Let's talk about AstraZeneca second dose pro. The pro is, we know AstraZeneca is a very effective vaccine, right? We've seen in the UK, which is where they used it primarily to vaccinate their population, that as soon as they got up to like 60% first doses, that just first dose, because they used the same strategy as we did in Canada with first doses, not only did the number of community cases plummet, the number of people being hospitalized plummeted, and it reduced the number of people, again, that were going into the ICU and that were dying. Like, AstraZeneca protects people against COVID-19, including at the time, the variant, which I think is now called the Alpha variant. We used to call it the UK variant, but they don't like to use those terms anymore. So against the Alpha variant, which everybody was terrified about, they were protected in the UK. So AstraZeneca is an excellent vaccine. And despite, and Alyssa and I went over this last time, despite what you've read in the media that after AstraZeneca, you're only %5 effective, as opposed to Pfizer or Moderna, which was like 90-something%. Remember, that's just about infection rate. It's not about severity of disease. We actually don't care if people get, well, we don't want them to get COVID, but if you get COVID and it's mild, we don't really care that much. We care about the people that are going to end up in ICU and dying, right? Influenza season, we don't want people to get the flu, but the flu happens, right? So we try to immunize whatever, but a lot of us get the flu, it's mild, nobody really cares. It's the older people and the more vulnerable that get it and end up in hospital at risk of death. So don't look at that 65 versus 80, whatever, because they're not head-to-head comparisons. They're just talking about infectivity. When we talk about hospitalizations and deaths, AstraZeneca versus Pfizer and Moderna, they all work. So that's a pro. Secondly, okay, AstraZeneca, if you get the second dose of AstraZeneca, you have your full series. We know, we have evidence already from other countries that getting that full series increases your protection. Like, we have good data to show that, real world data. What's the con? The one con for AstraZeneca is the risk of these severe blood clots, something called VIT. I won't get into the whole science behind it, but these are not, listen, blood clots in general, bad. We don't like people getting blood clots, but these are severe blood clots. Some of these blood clots go to the brain. They can cause death. It's bad. The first AstraZeneca dose you got, believe it or not, there was about a 1 in 50,000 risk that you could get a blood clot. And what we said at that time, and I don't regret saying this to anyone, is that the benefit of getting AstraZeneca at the time it was offered to you far outweighed any risk of blood clot, because your risk of getting COVID and ending up in hospital and dying was far higher than 1 in 50,000. I don't regret it then, and I don't regret it now. However, getting a second AstraZeneca shot still has a risk of severe blood clots. The difference is it's way lower. The number that most of us have been quoted is about 1 in 600,000. 1 in 600,000, right? Minuscule. Now, that risk over time will likely be a bit higher. Why? Because over time, we discover that more people that got AstraZeneca are going to get severe blood clots. How high will the risk go? I don't know. Maybe it's 1 in 500,000, but it's very low. So the first thing I say to patients is, how worried are you about a 1 in 500,000 chance of getting a blood clot? And you'd be surprised. A lot of patients say to me, I don't care about that at all. They understand risk. They know there's a risk when they get in their car and drive on the 401, and yet they go every day in their car. So we have to give people a little bit of credit when they're determining risk. So if you are not concerned about the risk of blood clots, you should get the second AstraZeneca. In fact, to me, it's a no-brainer. And you know it's available. It's going to be available starting tomorrow. Last week, by the way, a bunch of people already got their second AstraZeneca because the government in Ontario allowed people who had gotten AstraZeneca 10 weeks ago, which is different than now. Most people now, you're waiting for the 12-week period. They gave them an opportunity to get the batch that we had that expired on Monday, and a bunch of people took it. There was more uptake than we thought, okay? That's AstraZeneca. Now let's talk about your decision on whether you want to get an mRNA as a second one. So here's what we know. There's data from the UK that shows, actually, let's start with the pros. There's data from a Spanish study that shows if you start with AstraZeneca and then you get either Moderna or Pfizer, your body will elicit a strong immune response. So if they take blood from you about 2 weeks after you get the vaccine, it will show that your antibody levels against COVID-19 are quite high. Now, what does that mean in terms of protection? We're not 100% sure. Does that mean that you'll never get COVID-19? Does that mean that if you get COVID-19, you won't end up in hospital? We don't know. We make very reasonable assumptions that if your body's building a strong immune response, that you're probably getting the same benefit adding an mRNA on the back end versus AstraZeneca, but we don't know yet. So when will we know? Well, there's a study in the UK going on right now where they are doing every one of these combinations. Start with AstraZeneca, finish with Pfizer. Start with AstraZeneca, finish with Moderna. Start with Pfizer, finish with AstraZeneca. Like they're going all the different combinations. But that data is not available yet. The only thing we know, which is a bit of a con from that data, is that you get more chance of having mild side effects if you get Pfizer or mRNA after AstraZeneca. But if you ask my opinion as a doctor, who cares? So maybe 40% of people will get pain in the arm, or they'll feel lousy for a day. They get muscle aches and chills. They take Tylenol, they go to sleep, they get a day off, and then they're fine. Right now, it's about 20% after the second dose. So if it goes up to 40%, do we really care? I don't care, because those side effects are mild. But for those of you that are concerned about that, you've got to think of it. Now, most experts believe that when the UK data about the mixing and matching comes out, most people believe it's going to show that you're just as protected getting an mRNA as your second dose than if you picked AstraZeneca. That's what people believe. But can I tell you with a straight face that I have the evidence to back that up right now? I can't. So at the end of the day, it's a choice. You have a choice. You can decide what you want to do based on that information. And to be honest with you, aside from that safety risk of the clots, which is why the National Advisory Committee on Immunization has said very clearly that if the supply of mRNA is plentiful and you got AstraZeneca as your first dose, they recommend you get the mRNA as the second dose. Their main impetus for doing that was because they don't like blood clot risk. But as an individual, if you're willing to take the 1 in 500,000 chance, which is minuscule, and the fact that we know it's an effective vaccine, you should have every right to make that choice. So Alyssa, I'm going to stop there in case I said anything that was confusing. You want to add anything? But that's sort of the summary. And I even discussed it with Isaac. I thought he laid it out very nicely, but I'll hand it back to you.
No, I think you did a great job. I guess the take home is we have evidence that AstraZeneca, second shot, 2 shots of AstraZeneca, real world data from the UK is very good at preventing severe disease and death, our main outcome that we're really interested in. Secondly, if you really feel uncomfortable about your risk of getting the VITT, then now you have the option of going to mRNA. As the evidence is now showing, you seem to mount a very good immune response. Actually, the Spanish study does show that you mount a better immune response with AstraZeneca Pfizer than with 2 AstraZenecas. So I think you can't go wrong. What I've been telling everybody is get the first shot that you can get. That's the most important thing. And for both now, what the new information has come out that if AstraZeneca, your second shot, whether it's AstraZeneca or an mRNA, will occur at that 12-week window. Now, so since we've covered that, now let's talk about the next thing that's come up in terms of second shot vaccines, mixing mRNA vaccines. You got Pfizer first, you got Moderna first. What will be your second shot?
Yeah. So right now, and again, by the way, I just want to point out that this is why Alyssa and I came back tonight, because in a pandemic, things tend to change quite quickly. And I joked with Gail and Alyssa when we met last night that we're happy to come back in September after the summer when there's more information to share. So right now, because as far as we know, our supplies of both Moderna and Pfizer are plentiful enough to give everybody that got Pfizer first, Pfizer second, and everybody that got Moderna first, Moderna second, then it is still recommended that you get the same vaccine that you got the first time. Now, I want to dispel a myth here that's really important. And then Helen Stoller put something in the chat that I want to comment on, and I want to thank her for putting that in. And I'm not singling her out, but it's important. I'll bring this up in a second. So even though that UK study is gonna actually show whether or not you can mix even mRNA vaccines like Pfizer then Moderna, here's the reality. The studies that were done on Pfizer and Moderna were done very well. And it is very clear that if you get a second dose of Pfizer after the first dose, now remember, the studies for Pfizer was 3 weeks, Moderna was a month. We've extended it in Canada. I convinced all of you it was the right idea a few months ago. I still think it is. And the nice thing is you're actually getting your second dose, if you're on top of it, less than the 4-month wait that you thought you'd have, right? So my parents, I haven't worked out the exact math, but they got it 23 days earlier than they should have. So I think they got it around 3 months. And remember, since the last time we spoke, and then I'll go back to this, there was some other studies that showed out of a couple European countries that if you actually waited to get the second shot 3 months in, your antibody response actually looked higher. So again, we don't know if that correlates necessarily clinically, but it gives us a lot of confidence that even though we made you wait 3 months for your second dose, it's going to be fine. But the reason why we recommend Pfizer, Moderna is simply because that's the best evidence we have right now. The studies were very clear. Both of those vaccines were close to 95% effective at preventing you from getting COVID-19. Again, it changes a bit depending on your immune system, how old you are, whatever, but more or less, very good immune response. And there's absolutely no reason to mix them. But here's why Alyssa's question is so important. There seems to be a Toronto phenomenon, and it really is a Toronto phenomenon, that some people have this idea in their head that Pfizer is the greatest vaccine ever created for COVID-19. It's better than all the other vaccines. No matter what you tell me, Allan, Grill, Alyssa, I don't believe Pfizer's the best. I don't know where that's coming from. I have to tell you, it might be coming from incredible marketing from Pfizer maybe, which often happens with some of these companies. But I got to tell you right now, if I would have been offered Moderna, and by the way, I'm leaving AstraZeneca out because at the time of my vaccine, it was only Moderna and Pfizer available. If I was offered Moderna at the time I got my shot, I would have taken Moderna, I wouldn't have to think twice about it. So I don't know why there's this thing that some people have lost faith in Moderna. There have been stories, I swear to you, first dose stories where people have come to clinics, they showed up, they got a spot, they're sitting in the chair, they say to the vaccinator, what vaccine am I getting? They're like, Moderna. They've gotten up and walked out. They have actually given up an appointment because they only wanted Pfizer. And I don't understand it. It makes no sense. There is no data whatsoever showing that if you got Moderna, you are more susceptible for the disease. It's insane. And I don't know if part of it was because the Moderna shipments were delayed a bit. We didn't get as much. But remember, that happened with Pfizer too. So people tend to have short memories, right? So I just want to reassure all of you on this call that got Moderna first, okay? Anyone on this call got Moderna first. You should get Moderna second. And I'll add a bonus onto that. No matter where you live, be it Toronto, York Region, Peel, I don't care what, if you got Moderna first and you are 70 years or older, go register at Soccer City in Stouffville. You can either Google it or on the york.ca website, one of the clinics where you hit the 70 plus is Soccer City. I work there. I do about 2 shifts a month. They will take any human being right now, 70 or older, who needs Moderna as their second shot. No questions asked. They don't care where you live, where you work. So there is no problem right now with Moderna availability. Even in fact, today, we had, in the morning when I was there, we had 500 spaces. And in the end, we had to turn 25 away because they got confused and they had Pfizer first. So they just came to the wrong clinic. And then 75 people canceled. Why? Not because of Moderna, because they probably double booked somewhere else. It happens all the time. So if you would have come today, we would have had spots for you. So hopefully, Alyssa, that answers the question about the Moderna, the Pfizer.
Right. So I think, honestly, the only issue it would be if you need to, so Pfizer, there will be a steady supply. That's not an issue. The issue is the Moderna people. What do you do? If there is no availability of Moderna, then the recommendation is now they're interchangeable. You'll get it. There's actually very little evidence for this recommendation. It is a theoretical recommendation, and we do this all the time. People probably don't know that when you get a hepatitis B vaccine, there's 2 different companies, they're interchanged. So there's very little differences. There's small differences in the coding on the spike protein and differences in the lipid particle. But other than that, in the medical community, they're considered equivalent. And along with your saying about Pfizer being better, there's actually more side effects in the Pfizer study than in the Moderna study. So yeah, I don't know where this bias towards Pfizer has occurred. Now there was there was a question that was asked in terms of, I don't know if you saw it, but I've had to have a couple of patients who 7 to 10 days post Moderna vaccine, their arm gets really swollen and they want to know what to expect for the second shot.
Great question. And by the way, just before I answer that, Helen, I want to go back to Helen for a minute. So Helen wrote in the chat, and this is great feedback because I hadn't heard of this, that I think she or a friend of hers tried to go to a different hospital clinic to get their second shot, and they were turned away and sent back to their first clinic. So thank you, Helen, for sharing that information. I was unaware of that. I think this goes to show that our system still isn't perfect. I can tell you in York region, nobody cares where you're going for the second shot unless, like really nobody cares, but some people are getting the same phone call I talked about earlier or email inviting them to come back to the same place. So what I would say is, based on Helen's advice, I think it's good. What I would say to you is that if you got your vaccine at a certain site that is still vaccinating, I would try to reach out to that site first. You might save yourself a headache. Most of these sites have an email address that you can contact them. But I can tell you that I have stories of people that decided to go to a different clinic, even in Toronto, to get their second shot, and they were fine. So Helen, good point, and it's a good tip. Maybe people can take the extra few minutes and call the place or email the place where they first got it, just to prevent a headache necessarily. So thanks for sharing that. Okay, Alyssa, let's go back to what you were saying before. Can you just repeat it one more time, the question?
We were talking about the post-vaccination.
Oh, with the arm.
Yeah. With Moderna specifically.
Yeah, in fact, it's interesting. I was giving a shot to somebody today, and when we ask all these questions, have you ever had a reaction before? She actually said to me, yeah, last time I had Moderna, 7 days later, my arm got swollen and itchy and red. And we asked what she did. I think she put some Benadryl cream on it. She might have taken an antihistamine and she was fine. So what I would say is that so first of all, if you had a mild local reaction, like that's a great example, after the first vaccine, in this case, we're talking Moderna, there is a good chance that might happen to you again. It's not 100%, but there's a good chance it might happen again. And same as if you got fever or chills or muscle aches after the first shot, which the majority of people actually aren't getting, but if you did get it, there's a chance you'll get it again. So I'll tell you what I tell everybody that's in the chair that I sit with. Number one, anaphylactic or really bad allergic reactions, the ones that could kill you, those are going to happen within 15 minutes, which is why we make you sit tight after the shot. So if nothing like that happens by the time you leave the building, it's not going to happen. That's number one. Number two, for all the other mild reactions, usually they're mild. So we tell people to treat them conservatively. So in the example of the swollen, itchy arm, if it's very local and it's not starting to if it starts to spread down your whole arm, whatever, I would say you should seek medical attention. And in fact, any side effect from the vaccine that concerns you, don't be afraid to call your doctor or make an appointment to see them. Like, we fill out these forms, they're called AEFI forms, adverse events following immunization. We don't like filling them out, but we do. And this is how we learn about the things like Alyssa just asked, because enough people have been experiencing these local reactions. So most of the time they're mild. Most of the time you can get advice from your primary care provider on how to manage them. Don't be shy. But specifically for that, most people can either take an antihistamine as long as it doesn't react with the other meds. And again, check with your doctor if you're concerned. Some people put topical, Benadryl cream to reduce the itch. But again, most of these are pretty mild, and don't be afraid to reach out to a health professional with an answer. Alyssa, do you have other advice on that?
So I had a patient who had really bad swelling after the first shot. And this was way back when only the people who were essential caregivers of people in long-term care were getting it. So I didn't have any experience, but I looked it up, and she actually did qualify to get a second shot. And she actually only had a minor reaction with the second one. So it was worse with the first. I know there's a question about a lot of people had a strong immune response and felt really unwell after AstraZeneca. And there's a question about what happens after the second. My experience with patients who've got second AstraZeneca, that they felt they didn't have that same feeling terrible for 2 days after. They said that they had no problems with it. Limited amount of people, anecdotal information, but that's what I'm hearing so far. People who've got Moderna have complained a lot about headaches. AstraZeneca people have complained a lot about headaches. So the headaches seem to happen with the second Moderna as well, but it goes away usually within a week.
And Alyssa, I don't know if you and I talked about this last time, but what was your experience after your second dose? Was it worse than the first?
Actually, I had a headache for about 12 hours. I was all prepared to feel unwell. I had a headache for 12 hours. It went away, might not even be related. And I was disappointed because I thought maybe I'm not mounting a good immune response because you're supposed to get worse.
Yeah, so it's funny. So I think I might have told this group, the only thing I felt after my first vaccine was pain in the arm for about a day. And it didn't really bother me that much. After the second shot, I felt like I had the flu for about 12 hours. I went to sleep, I took some Tylenol, whatever. Didn't work the next day, whatever. Anyways, I'm joking because I kept telling my parents, I kept saying, oh, second shot, congratulations. Don't be surprised if you feel sick the next day. And I even called them the next day. They felt nothing. I think my dad had a little bit of pain in his arm. They were fine. So they're probably thinking, this doctor doesn't know what he's talking about. Like, we felt great. So remember, not everybody after your second dose has side effects, right? They claim it's up to 20%, but there's a lot of stories of having it. So I just tell people, be prepared that the next day you may not feel great. And so don't necessarily book something important that you want to do, even though most of us are not doing much these days anyway. But you may get nothing, and that's fine too. And your body will still mount an immune response, as Alyssa just said.
Now, let's move on. It's almost 8:45. Let's move on to, there's a whole bunch of questions about once you have been vaccinated, and we'll talk about different scenarios. If you've had one vaccine, if you've been doubly vaccinated, what can you do in terms of interactions and getting together with family members? So let's start off with an easy one. You've been doubly vaccinated. Can you get together with other family members?
Okay, so I'm going to answer this in two ways. I'm going to tell you what the public health rules are right now, and then I'm going to try to give people a little bit of practical advice because I know that that's what they want. Okay, so right now, what the public health advice says that in Ontario, in fact, in Canada, even if you're doubly vaxxed, you're not supposed to hang out indoors with other people, even if they're doubly vaxxed. So I'll give you a great example. My parents will be 2 weeks post-vaccine. I'm pretty sure it's a week tomorrow, something like that. And theoretically, they're double vaxxed, I'm double vaxxed. I should be able to go into their house, hang out, unmasked, lie on the couch, eat my mother's food, should be able to do all of that. But public health right now is not saying that. They're actually just encouraging as many people as possible to get their second vaccine. And I'll go on a little bit of a tangent here, so I might answer Alyssa's question that's coming up, but this is really important. I know what all of you are thinking. You're thinking, I look down to our neighbors in the South in the US, and I'm seeing people at baseball stadiums. I'm seeing people indoors at hockey stadiums. Some people are masked, some aren't. I'm hearing that the CDC is saying, once you're double vaccinated, at least 2 weeks post your second shot, you can hang out with anybody else that's double vaccinated without a mask. You can even hang out with what they call low risk people, which goes into, can you hug your grandchildren, right? Most kids don't get COVID-19. Even if they do get it, most of them are asymptomatic, but they're low risk. And if they haven't been like, hanging out in crowds or going to concerts, the CDC actually says if it's a low risk person who isn't fully vaccinated, you can actually hang out with them indoors. They've really talked about the benefits of vaccination. And a lot of people in Canada and in Ontario and probably on this call are thinking, well, if they're doing it in the States, why can't we do it here? So this is a really key point. And then I promise I will loop back to practical advice about the grandchildren and getting together. So you have to remember something. In the United States right now, their first dose percentage is around, I think, 65%. I actually think Canada's a bit higher, Alyssa. I think we're about 70%, but whatever, it's pretty close. But the difference is the second shot. In the United States, they're about 50% double vaxxed. We're at like 6% in Canada. That's a huge, huge difference. So in the United States, just by having a much higher percentage of people that are double vaxxed, what happens? That means that COVID-19 has less chance of going from one person to the next. It's like that whole concept of herd immunity, right? If somebody has COVID-19 and they walk into a room and everyone in that room is double vaxxed, the chances of those other people in the room getting COVID-19 is pretty low because they have protection, right? Doesn't mean it's zero, but it's pretty low. But in Canada, we're not at that level of double vax yet. So our governments are being uber conservative about what you're allowed to do with getting a second vaccine. That's reason one. Reason number two is still very important. Alyssa and I talked about this yesterday, and we're totally on the same page. There is a new variant right now called the Delta variant. Some of you might know of it as the India variant, but we're supposed to be politically correct and call it the Delta variant so we don't cause racial discrimination in countries. The Delta variant is something that the experts are keeping a very close eye on, and they're worried about it. Why? Number one, it's a variant of concern. So just by definition, what we think is that it transmits better, which is bad for us, and it causes some more severe disease. So the UK variant, which is called the Alpha variant, the B117, all the experts were right about that. And you can look back at the newspaper articles where at first it was 10% in Ontario, then 15, then 50%. They were right all along. It was coming. It was gonna take out the other COVID-19 strain. Younger people were getting it much quicker. It was high. It was transmitted more sick cases, like bad. So the same idea is what's being predicted for the Delta variant. So what we have to remember is, as much as us double vax people want to go and have a party with other double vax people, or just even get together with those friends indoors, not masked, the problem is we still don't know when you're double vaxxed. We're going to get this data soon, but we don't know if what are your chances of carrying COVID-19 even if you're double vaxxed? B, what are your chances of transmitting that to someone else that's double vaxxed? We don't know. And the other thing I worry about, and I think of my parents a lot here, my parents are in their 80s. Are they at 95% effective protection 2 weeks after the vaccine? Maybe. But we know that people in their 80s don't have the same immune response as they did in their 60s or their 50s or their 40s. So do I think my parents are way more protected now than they were even a month ago? For sure. But how much protection? We're not sure. They're doing modeling right now based on real world data of what are the benefits of vaccine, because we don't want to live like this for the rest of our lives. We don't want to be, even if we're double vaxxed, we don't want to be living like on Spilkus forever, right? So right now, the only thing you're allowed to do when you're double vaxxed is what the reopening plan is in Ontario. So I can tell you that, like, in the next 2 weeks, one of the things is going to be you can get together, I think, with 10 people, right? They're talking about getting together with 10 people. So if they're saying you're allowed to get together with 10 people, I can't tell you not to. But this is what I will tell you. We're so close. I'm not just telling you this. We are so close, I think, not to the end of the pandemic, because I think the pandemic will linger, especially in some other poorer countries that don't have the advantage of vaccines that we do in Canada. But in Canada, we are so close to getting back to a life that is as close to normal that you can even remember from like late 2019. We're like 2 months away. I mean, our governments are trying to get us to like 70, 80% double vax over the summer. As long as people are willing to go for their shot, we're going to get it. We're going to get it in our youth. They're going to go back to school, right? And I can promise you that once we're at a certain percentage of double vax, and the government's already talking about when we're 70% first shot and 20% second shot, so they're already talking about this stuff. The amount you'll be able to do really soon is going to be crystal clear. So what I ask of you now, and then I will get back to the grandchildren because everybody wants to hear about that, and I will give you my advice. What I ask for you now is to just please continue to follow the public health recommendations. I do not think right now that even if you're double vaxxed, 2 weeks after you're double vaxxed, that you should be having other double vax people outside your family in your home. I really don't think you should be doing that. I don't think you should be around those people indoors without a mask. So if you happen to be at the grocery store, they're going to force you to wear a mask anyway. But my point is, if you're inside, you shouldn't be without a mask if you're with people outside your household. I'm still going to follow that. But can you see other people? The answer is yes, but you have to do it safely. So let me give you an example that you already know about. There is no reason once you're double vaxxed. In fact, I would even argue if you weren't double vaxxed, you could do this safely, that you can't have another couple or a couple of couples over to your home in the backyard, spaced out without a mask. I would be honest. I still tell people that if you're outdoors and you're able to physically distance the 6 feet, you don't need a mask. You want to wear one because you're more comfortable, that's fine. When I go to my parents' house now and I'm outdoors and I'm 6 feet away from them, even before they were double vaxxed, I wasn't masked, okay? Now, if I was really close to them sitting on the front porch, my daughter's with me and she wasn't vaccinated, I was masked. And so were my parents, and we were smart about it. But outdoors, you're 6 feet apart. The risk of transmission outdoors is very, very low. So you want to have a couple friends over for lunch. If they're double vaxxed, that's even better. And you're able to physically distance, I think you should do that. Now, what about grandchildren? Can you hang out with your grandchildren? So this is what I'm going to tell you. When my parents' 2 week point comes up, I am going to let them hug my children. And when I say let them, I'm going to be okay with them hugging my children. But here's one little caveat I'm going to do still, because how much I love my parents. My son and daughter both have one vaccine, only one. So I don't really know what that means yet. I don't know. Can they still carry COVID? Can they still transmit it? Could they have the India variant, the Delta variant, and not know about it? And if they go to hug my parents and nobody's masked, they get kisses, and my parents' immunity isn't as high as I think it is, and God forbid they end up with one of these variants and end up in hospital, do you know what that's going to make me feel like? Jewish guilt doesn't even explain it. So my advice to you is this. I think you should hug your grandchildren when you're double vaxxed, but I think you should do it safely. I think you should do it with a mask. And I think that that's okay, because the feeling you're going to get when you hug them is going to be tremendous. It's going to be out of this world. I'm going to start crying probably when I see my parents hug my kids, right? And I'm going to hug my parents too, but I'm going to do it with a mask. And I'm going to do it that way because I'm a very conservative person. And until the public health experts tell me otherwise, I'm going to be conservative. And I'm trying to give you practical advice because I want you to hug your grandkids. You're double vaxxed. There is benefits to that. But we still have to be careful with these new variants. And we just literally, we're weeks away from getting to a point where the benefits of you going to get vaccine are going to pay huge dividends. Now, I'm going to stop and ask Alyssa to weigh in, because Alyssa might have a bit of a different opinion. That's okay. Because a lot of what I'm saying is erring on the conservative side, but I'm really trying to give you the same advice that I would do myself or that I would tell my patients. Alyssa?
No, I think I'm on the same with you. I'm extremely conservative. I double mask. If I see anybody in my family they're double masked. I've had 2 vaccines for 3 months. I don't do anything other than work and be at home. So I know that I have a low risk. I just feel like we're at a tipping point that if we keep going how we're going and we keep our numbers down and the government keeps things closed for the next 2 weeks, we will be in a way better place through the summer. With the Delta variant, it is increasing. It is exactly where we were in February and March. It is slowly increasing while we were all at a stay-at-home order. So it is going to get bad, and that's why there is a push for everybody to mask, because vaccines are one part of the story, but the second part of the story is that you have to maintain distance and you have to be masked. There was a study in the US that showed that vaccination is important, but you will prevent even more deaths if, including with vaccination, you still maintain public health measures, which is distancing and wearing your mask. So I'm with you. I would wear a mask. I'd actually be nervous not to wear a mask, like with how much things have switched in 15 months. And I think, well, we should all continue wearing a mask. For sure indoors. I wouldn't do anything indoors with people. I would be outside, especially through the summer.
Totally agree. The other thing I was just going to mention, you took one of the points I was going to mention, and what was the, oh yeah. The only other thing I was going to say, and we mentioned this last time, that the concept of tikkun olam, I mentioned it about healing the world when we talked about more first shots in arms is better than less second shots in arms, if that makes sense. And I think everybody bought into that. So here's another tikkun olam for you. For those of you not in healthcare, I can't tell you how hard it was in the month of April, seeing the number of people in ICUs, young people, people my age and younger, in ICUs, away from their families. Some of them died, couldn't even say goodbye to their family members. And not only that, but it got to the point where family physicians like myself, who I haven't been working in I don't think I even did an ICU rotation in my residency, Alyssa, I don't know about you, but they were asking family doctors to volunteer, not to be the attending physicians in ICUs, but just to do some nursing work, just to relieve the nurses who hadn't had a break in days, weeks. So if we believe in tikkun olam, and as Alyssa said about this Delta variant that we're still learning about, continue to follow the rules, even if that just prevents further transmission to people that will end up in hospital. Because if our healthcare system gets anywhere close to it, to where it was in April, it was this close to collapsing. Do it for the healthcare workers so that we don't have to go to people like Allan to work in ICUs. Allan should not be working in an ICU. That's not what I do for a living, right? I should be doing family medicine. So do it for that reason. And again, remember, in the United States, they have such a robust healthcare system that even if they're getting more cases, they're not overwhelming the system, right? It's not sexy to report in the media. There's probably still a bunch of people getting sick from COVID there, less than before, but they're not, their system's not going to collapse. In Ontario, we were this close. So for a tikkun olam purpose, stick with the public health guidelines as close as you can.
And I guess that leads into our whole next section. I hope everybody can stay for a little bit longer, even for a couple of minutes. There's a whole, what should we do about vaccinating our teens? So a couple questions. So as a parent, do you vaccinate your teenagers? The risk of COVID is very low. And then also there's a dynamic that exists that people are upset that why are we vaccinating people who are low risk when we should be giving second shots to older people who are at greater risk. And then also along those lines, there's people around the world who are very upset that why is Canada vaccinating teens when we should be giving vaccines to healthcare workers around the world? So how do we help people to understand why the government has started vaccinating 12 and up?
Yeah. I'm just taking a couple notes so I don't forget the last two parts of the question. Yeah, okay. So I'm going to address the one of the things you said first, because I have a strong opinion about this. As first of all, I vaccinated both my children, and the other piece of advice I'll give people on this call, if you haven't vaccinated your kids yet, for whatever reason, you haven't had time or you're struggling with it, and hopefully tonight will help you. I'll give you one piece of advice that a very good friend of mine, Eyal Cohen, who's a pediatrician at Sick Kids, gave me. When we both were talking to each other about vaccinating our kids, and it wasn't a long conversation because we both felt strongly that we should do it. He asked me a very interesting question. He said, "Did you ask your kids if they want to be vaccinated?" And I paused for a second and I said, "No, I assumed that my kids wanted it, and we told them we were signing them up. We didn't get any pushback." But it was very interesting, and I won't get into the whole consent thing, because interestingly in Ontario, there's no age of consent. So if a 12-year-old can appreciate and understand the risks and benefits of getting a vaccine or not getting it, even if their parents don't want them to go, if they sneak out of the house and get it and book a clinic and get the shot, their parents can do nothing about it. But that aside, because hopefully that's not happening in families that are in dialogue and close with each other, I finally asked my kids if they wanted it. And it was very interesting because one of my kids looked at me crazy and said, like, "Why wouldn't I get it? Like, it's going to protect me." Well, that was a good answer. One of my other kids said, "Well, all my friends are getting it, so I figured this was probably the right thing." So, don't underestimate people's reasons for getting vaccine. They might be a little bit different than yours. And engaging in this dialogue with them is very important, because number one, you might uncover some hesitancy that you didn't realize. And it's very important that before they go, if they decide to go, that they understand all the things I'm about to tell you. And you want them to be comfortable, just like I wanted my parents who got vaccinated in March. I wanted them to be comfortable too, understanding why they should get it. So the first point is about the time. If you would have asked me at the time they announced the 12 to 17, I would have said I would have preferred moving up the 80 and 70 and 60, like the most vulnerable populations, first for their second shots before my kids got their first shot. And here's why. So number one, 12 to 17, very, very few hospitalizations, number one. Very, very few COVID cases where they even got symptoms. Slight rare risk of an inflammatory disorder that you can get, which I'll come back to in a minute because it's relevant. So there is some of that. But there's been a few hundred kids in North America that have died of COVID-19. So it's not zero risk, but compared to the other populations, I think the other populations should have gotten them first. Why didn't I go on TV and say that? Two reasons. One, I didn't make the decision, the government did. So once a decision's made, I can say what I want, but it's not going to change it. But two, we actually had enough supply so that there was a 2-week window where 12 to 17 were offered it as a first dose before we started offering it to 80 plus and now 70 plus. Does 2 weeks make a huge difference in the grand scheme of things? Probably not. So I think in the end, it's moot. It's now available. We've got a lot of supply. So do I think the government made the wrong move and should have opened it up maybe at the same time? Probably, but they didn't. I've kind of forgotten about it. So that's point number one. Point number two about other countries. And you know what? There's a lot to be said about this because, there's this whole idea of, love thy neighbor as you would love yourself. I think it's one of the 10 commandments. And, it's very important that we don't forget about other countries. But here's the problem. The problem is you're in a much better position immunizing your own country and getting it protected first before you start putting your own country at risk helping others, right? Like, I'm not an ethicist, but you could argue that is it better to help everybody equally, but then still have a bunch of cases go up? Again, that's assuming the supplies are equal. Like, I would love to see equal vaccine to every country, but because of the world we live in, and Canada happens to have more vaccine than other countries, does it make more sense to ship that vaccine out? Some people believe it does. In my opinion, I think that we owe it to Canadians. The government has sort of made a promise to us that they were going to try to protect us. They've spent our tax money and made their policies however they could to get us vaccine. So in my opinion, as a healthcare worker that's responsible for at home first, I would like to see our country vaccinated. If we get to a point, even before we get to whatever percentage we want, that we realize our supply is going to be greater than the demand, should we send that immediately to other countries? Absolutely. And remember, Canada did pay into that COVAX program, I think it's called, so that other countries can access a certain supply of vaccines. So it's not like Canada's not helping anyone. But I think right now, most Canadians have sort of been given the reassurance that we're going to use our supply to help us the most, knowing that if we have any extra to spare, we'll give it to other countries. So I'm not trying to be one of those people that doesn't believe we should help others, because if I was in their shoes, I'd want countries to help me as well. But this has to be a global effort. And I'm sure that most countries are having ongoing conversations about sharing supply whenever they can. It becomes much easier when you get to the point in your own country where cases have gone down and people are protected. So again, that's just my opinion. I'm sure there's others that might disagree, and that's okay. The ethics behind it are complex, and I'm not an ethicist, but that's how I sort of justify where we're at now in Canada. In terms of the 12 to 17, so why do I think it's important that we get that age group done before September? So to Alyssa's point, if we didn't get them done, would I be worried? And we gave, let's say, those doses to other countries, which would have a small increment assistance to them. Would it actually impact the risk of kids? And like I said before, probably not. But here's why I think it's so important that we not only had studies to show that from 12 to 17, the Pfizer vaccine, because that's the only one we have right now. Moderna, you have to be 18. So Pfizer's the only one we have right now for 12 to 17. By the way, there's other studies that we're going to find out soon from 6 months to 11 years, but we don't have them yet. The studies that were done in those kids were excellent. So the effectiveness was there for protection, very minimal side effects aside from the minor ones we've talked about. And so number one, it's going to protect them against getting COVID, and it's going to reduce even the small risk of hospitalization and death, number one. Number two, it makes me feel better when they go hug my parents, they've had at least one shot. So it just reduces the overall risk of transmission. And when they get their second shot, it's going to reduce it even more. So from a community perspective, it makes sense. But here's the key point, and it actually has nothing to do with COVID-19 transmission. It has to do with the mental health and social isolation anguish that our children have suffered during this pandemic. And unfortunately, they have suffered more in this province than they have across the country, because Ontario has shut its schools down for longer than any other province in this country. And it's probably one of the highest amounts of shutdown of schools, even compared globally. I won't get into the politics behind that because it's not important, but the amount of time that kids have missed in school has not just resulted in kind of getting annoyed with being on Zoom. It has caused kids with learning disabilities to not get the support that they require. It has caused kids to become socially withdrawn because they're not interacting enough with their friends and peers. It has caused kids to be super anxious and depressed because they're worried about COVID. They're worried that they're going to give it to their parents. They're worried that they're going to give it to their grandparents. They're upset that they can't see family members as frequently as before. And this could go on and on. Eating disorders is up. Consultations in our offices and mental health has gone way up. The only way we can solve those problems, and believe me, it's going to take a while to get them back to baseline, is to vaccinate them. And then why? Because then they can go back to school. And I can tell you that if we get that second shot into every 12 to 17-year-old before September, which I think we can, I think the government's promised it, I think we have the supply. And we know the teachers are going to have an opportunity because most teachers got their first shot already, and their second shot's going to come up like everybody else here. So they'll get it before September as well. Our kids can go back to school. Now, what will school look like? Will there still be masks? Probably. Will there still be physical distancing? Probably. Will we still have to improve ventilation? Probably. But they will be in the classroom. And not only that, but by the time we get to September, as I said before, the public health restrictions will be less. More kids will be able to get together outdoors legally, you know? More kids will probably be able to. So this is why it is so important to vaccinate our children. It is effective. It is safe. It's going to get them back to school. The benefits far outweigh the risks. Now, some of you might have read, this is the last thing I'll say, and then I'll hand it back to Alyssa. Some of you might have read, and Israel is doing some interesting work on this. There is one side effect that has been a signal that might occur to more adolescents and even younger people in their 20s with Pfizer. It's called myocarditis. It's an inflammation of the heart muscle. The nice thing about myocarditis is it's pretty mild. Most of the time it resolves on its own. Most people don't have to be hospitalized with it, but it can be scary. You can present with chest pain, sometimes trouble breathing, you know, stuff like that. But what's interesting is that we don't know if it's related to the vaccine yet. It's too early. There's a signal, right? And it's good that there's a signal. Why? Because it shows that people are looking at real world data. If we weren't getting signals, we might start to think, was anyone looking at this? What's the conspiracy? So we don't know yet if it's related to the vaccine, but we're keeping an eye on it. And in fact, Israel has already decided that they're going to hold off on the second dose of Pfizer in their 12 to 17 until they have more information. Now, should Canada do that? I'm not saying they should. I'm just telling you that different countries are looking at this. The other thing about myocarditis that I said earlier is that if you get COVID as a young, like an adolescent or a kid, a certain percentage, it's low, get this inflammatory disorder. It's like this condition where you get a bunch of inflammation in your body. I'm trying to say this in as simple way as possible. And one of those inflammatory consequences is myocarditis. So you can make the argument that what's better? Do you want to get COVID and then get myocarditis? Or do you want to take the chance that myocarditis might be a mild side effect of the vaccine? I'll take the vaccine any day when you add in all those other benefits. So the conclusion, I think every 12 to 17 should get the shot. There's lots of spots for them to get it. It'll put them back in school. And I have no reservations about it whatsoever.
Okay, quick question. One word answer. Does it cause fertility problems?
No,
Okay.
not as far as we know, no.
Miscarriage? No.
No.
Period irregularities?
Not as far as we know, but you know what? There's a lot of stress out there right now, and that can cause period irregularities too.
Yeah. So we're gonna wrap up now. And so when we finished last time, I said to you, we've talked for over an hour. What's your take-home message that we want to leave with everybody this time?
Great point. So my take-home message is this. I'm in a much better place emotionally than I was when we left the last time. I think that the effort specifically, not just in Canada, but in Ontario for vaccinating people has really been tremendous. My clinic alone, which a lot of you experienced early on when we rolled this out, it gave its 100,000th shot last week. Can you imagine? 100,000 just in my clinic alone, it makes me really proud. So I think everybody's banded together to get shots in arms. And I think we've done a very good job. And I think we'll continue to do a good job. So message number one is, please get your second shot as quickly as possible. There was a question in the chat that said, how early can you get your AstraZeneca second shot? So the answer is, I think, as early as 10 weeks. But then I heard recently that they're trying to, now that they're getting a bigger supply, they want everybody to be at 12 weeks. So you're going to get that information probably by next week, but I think it's 12. So aim for 12 weeks. And like I said to some people, if you got AstraZeneca and you're not sure where to get the second one, right when you're around 12 weeks, just phone a pharmacy if you haven't been contacted and find out if you can get it at 12 weeks, and they'll be happy to bring you in. So number one, get your second shot. Number two, you will reap the benefits of being fully vaccinated. I promise you. You just have to wait a little longer. So as Alyssa said, take advantage of the warm weather. Do as many things as you can outside. Do it with other people, but do it physically distanced. And don't do it in huge crowds. Don't have a party at your house in your backyard for 20 people. Like, that's a bad idea. You want to have, right now you can get together with 5, right? Soon it'll be 10. Stick with the numbers that are reasonable, but do it safely. So physically distance. And if you're still a bit concerned, wear a mask. I'd still avoid the inside stuff with people outside your own household until you hear further. And I promise you, when I hopefully see you in shul in the high holidays, I'm really hoping, I want you to come up to me and say, I'm glad I didn't have that party in June, because now that we're at Rosh Hashanah, Yom Kippur, Sukkot, we can do way more things. And I don't regret not doing it back in the spring. That's number 2. And here's number 3. Continue to be nice to each other. This has been a very rough 15 months. I mean, we all shared stories with each other. We won't go through it now. I've heard things from patients that have really blown me away on some of the challenges they've had. This is a time where we need to sit back and say, we're all in this together, because COVID does not discriminate. We thought it discriminated first to older people, but we learned with the variants of concern that COVID takes no prisoners. It takes everybody, right? Spares no one. So be nice to each other. Somebody's taken a little too long in the line at the grocery store. Don't yell at them. Politely say, excuse me, the line's moving up. If somebody takes that parking spot that you were going for. Don't honk at them. Give them the benefit of the doubt. Maybe they're having a bad day. So the pandemic has really done a number on us. And now is the time to be hopeful, to be happy. Get some sunshine, right? Wear some sunscreen. Really, I'm very hopeful. And I'm not just feeding this to you. I really believe that. And you should believe it too. We're going to get through this together.
Thank you. I think
Thank
that's
you.
oh, sorry, Gail.
Well,
I was just gonna
Alyssa
say-
has to give her message.
No, I'm with you. I'm with you. I think that everybody just has to stay the course. I don't mean to be like a negative Nancy, but we all have to be prepared. The fall and the winter will not be a typical fall and winter. And that's why I think if there's a lot of interest, that we will have a lot of other questions that we have to answer. Like, if you've had COVID, do you only have one shot? Do you need 2 shots? How long do vaccines, the efficacy, does it last? Do we need a booster shot? How are we doing with variants? So and what's going to happen to children under the age of 12? Are they going to be allowed to be vaccinated? Where do we go as a country? And so if there's interest, we've all talked about how we can pick up the series again in the fall, because there'll be a whole bunch of new questions that we'll have to ask and to answer.
Yes, thank you to both of you once again, Dr. Name and Dr. Grill. And I hope both of you have a healthy and enjoyable summer. Thank you for all that you do on the front line, and also for the congregation. We all appreciate all your efforts in helping all of us to get our vaccines in an expedited way. And for sure, we would love to have you back again in November, because we had so many questions and comments. I hope we answered a lot of our members' questions. And yeah, we look forward to seeing you again in the fall, and hopefully in Shul on Rosh Hashanah. So thank you to both of you once again.